Today, we will discuss health appraisal and screening procedures, particularly the screening procedures of scoliosis and breast self-examination. At the end of our discussion, you are expected to explain the proper health appraisal. One way to do health appraisal is knowing your health status. And that is why it is important to go through regular health checkups and screening tests appropriate for you. How many times do you visit your barangay health center? Do you go with your parents to attend medical program in your barangay? Can you identify the medical tests that you had since elementary? The answers to these questions help you to know your present health status. Maybe sometimes you are asking why your teachers are monitoring your height, weight, and even computing your BMI or body mass index, asking if you have hearing defects, and knowing if you have eye problems. These are all part of screening procedures in health appraisal. Health appraisal are a series of procedures to assess or determine your health status. Example, screening for blood pressure, testing your vision and hearing, and even updating your immunizations. For the girls, it is recommended to check your breast for possible masses or lumps the moment you start menstruation. And to do that, you should know how to perform the breast self-examination or BSE. Of course, you will be learning that in this video. Aside from BSE or breast self-examination, we will be discussing also the procedures in scoliosis screening. And this is for both girls and boys. Now, let's make this learning fun and enjoyable. How to do the breast self-examination or BSE. Lie down on your back and place your right arm behind your head. Use the finger pads of the middle fingers on your left hand to feel for lumps in the right breast. Use overlapping dim-sized circular motions of the finger pads to feel the breast tissue. Move around the breast in an up and down pattern, starting at an imaginary line drawn straight down your side from the underarm and moving across the breast to the middle of the chest bone. Were you able to follow the procedures? That's great! For better understanding to this information about self-breast examination, watch this video.
A woman's breast is composed of glands that produce milk, ducts that transport milk, supportive connective tissue, a nipple and surrounding areola, and fat, which gives the breast its size and shape. Most women experience periodic changes in the shape and contour of their breasts, often during puberty, pregnancy, and menopause, and due to such factors as the menstrual cycle, weight gain or loss, use of birth control pills, or aging. Such changes include a lump or lumpy area, a thickening of the breast tissue, an area that feels different, indentation of the nipple, discharge from the nipple, puckering or dimpling of the breast skin, a change in breast shape, or pain. Sometimes, a change in the breast can indicate a health problem, such as breast cancer. Although this will not be true in most cases, it is very important that all breast changes be investigated. For if cancer is found, the earlier it is detected, the better the chance of effective treatment. Normal breast tissue has a soft, dough-like consistency, and to the pads of the fingers can feel pebbly, fibrous, grainy, or lumpy underneath. Breast abnormalities, on the other hand, are the different than your usual masses of tissue located anywhere in or on one or both breasts, including the tissue extending from the breast to the armpit. Becoming more familiar with your breasts through breast self-exam, BSE, can help you tell the difference between normal breast tissue and a breast abnormality. Every woman's breasts are different, so it is important that you get to know the look and feel of your breasts to better find any changes unusual for you. Women aged 20 and older, including those women with breast implants, ideally should perform BSE once a month. The best time to perform BSE is just after your monthly period has ended, in those first few days when the breasts are least tender. For women who no longer have periods, BSE can be done on the same day each month. BSE does not need to be performed more often than once a month. In fact, checking the breasts too often may mean missing subtle, gradual breast changes. Please note that BSE is used alongside and does not replace regular clinical, doctor-performed breast exams or mammograms. A BSE is a visual and physical inspection of your own breasts, done while both standing and lying down. The breasts are checked for their usual size, shape, and color, and any unusual distortion or swelling, spontaneous nipple discharge, dimpling or puckering of the skin, inversion of the nipple, redness or lumps. This presentation discusses 4 basic steps to a breast self-exam. First, undress from the waist up and begin by just looking at your breasts in the mirror with your arms at your side or on your hips. Check that both breasts are their usual size, shape, and color without any distortion or swelling. Look for a change in the nipple, a change in the texture of the skin, and any lumps. Next, while still in front of the mirror, put your hands behind your head and check the appearance of your breasts again. Then, feel your breasts while you are lying down. Lie on your back with your right hand behind your head and a pillow under your right shoulder. With your left hand, using the pads of the fingers and keeping them flat and together, feel the entire right breast from top to bottom, side to side, from the collarbone to the top of the crease under the breast, and from the armpit to the space between the breasts. It is important to check the surrounding areas, as breast cancer can be found in nearby lymph node tissue and under the arm. Feel for any lumps, thickening of breast tissue, or areas that stand out as different. Take notice of a lump that persists or gets worse or more obvious over time. Once you have finished examining the right breast, repeat this process for the left breast using your right hand. Be firm but gentle when examining the breasts, and examine each area with 3 levels of pressure. A very soft touch at first to feel just under the skin, then with a medium touch to feel a little deeper, and finally with a firm touch to feel the deepest breast tissue closest to the breastbone and ribs. It is helpful to follow a pattern when performing breast self-exam to ensure you cover the entire breast. For example, you could start by circling the nipple and move in larger and larger circles outward toward the edge of the breast. Or, You could move your fingers up and down the breast in rows. Also, you could divide the breast into sections like pieces of a pie, feeling the breast in one section and moving to the next. For any pattern, whether moving around the breast or in straight lines, the fingers should move in tiny circles the size of a dime. Also, it doesn't matter which pattern you choose, but it is best to use the same technique each time. Finally, feel your breasts while you are standing or sitting. Many women find it easiest to examine their breasts while the skin is wet and slippery, so they like to do this step in the shower. Other women find it easier to slide their fingers over the skin with a skin lotion. Raise your left arm, and again, using the pads of your right fingers, examine the entire left breast, using the same hand movement you used in step 3. Then, raise your right arm and use your left hand to examine the right breast. Record your observations and mark the calendar for next month's self-exam.
Breast cancer is the most common cancer affecting women in Singapore. It is estimated that 1 in 14 women before the age of 75 will develop breast cancer in her lifetime. You can keep a lookout for breast abnormalities, starting with a visual examination of your breast with your arms by your side in a neutral position in front of a mirror. Look for any of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple, persistent rash or change in the skin around the nipple, nipple inversion, retraction, bleeding or unusual discharge, skin redness or soreness of the breast, accentuated veins of the surface of the breast, unusual swelling of one upper arm. Adopt the following 2 positions. Raise your arms above or behind your head. Press your hands on your hips and tense your chest muscles. These 2 positions allow for a closer inspection of the following: changes in the shape and size of one breast, dimpling or puckering of the breast skin or nipple. To feel for changes in your breasts, underarm and collarbone areas more accurately, do so by lying down because the breast tissue spreads out evenly across your body. This makes it easier to feel for lumps. What you should look out for: a lump, swelling, or thickening in the breast or underarm area. Any enlarged lymph nodes at the underarm and above the collarbones. Lying down. How to examine your breasts when lying down. Elevate your right shoulder by placing a folded towel or pillow underneath. Extend your right elbow outwards and place your right hand under your head. Use the pads of your 3 middle fingers and apply pressure to feel your breast tissue in a circular motion. Use 3 varying pressure levels, light, medium, and firm, to feel for all the breast tissue from the skin level to tissues closest to the muscles and ribs before moving on to the next area. Examine the whole breast systematically in a clockwise or anti-clockwise direction. Press down over your nipple with 3 varying pressure levels in a circular motion. To check for lumps at your underarm area, put your arms by your side. Start in the hollow of your underarm and move towards your breast, making overlapping small circular motion. To check above the collarbone, use light pressure and move in a circular motion. Repeat the same steps on your left side. How often should you perform breast self-examination? The best time to perform a self-examination is about a week after the start of your menstruation. It is more effective to perform on the same day of each month if you are no longer menstruating, pregnant, breastfeeding, or have breast implants. It is important to understand that breast self-examination can complement breast cancer screening, but it is not a substitute for it. Most lumps or changes in the breast are not cancerous, but as a precaution, it is advisable to consult a doctor as soon as possible.
And that is how breast self-examination is being done. Next is the screening test for scoliosis. Scoliosis is a condition in which the spine curves to the side. It is an abnormal lateral or side-to-side curvature of the spine. The following signs should be referred to a doctor for treatment. One side of the shoulder blades is more prominent. The head is not aligned to the center of the pelvis. A hip appears higher or is more prominent than the other. The rib cage is uneven. The waist is uneven. And the entire body is leaning to one side. And to better understand how scoliosis screening is performed and how it is being treated, watch this video.
You may be wondering how scoliosis is detected. Scoliosis can be detected a number of ways, but two of the most common are 1. At a consultation with your trusted care provider, or 2. During a school screening. What are school screenings, you ask? School screenings are conducted at your school and performed by a school nurse, athletic coach, or PE teacher. School screenings may take place at different times for boys and girls. Because boys and girls generally mature at a different rate and different ages, girls are typically evaluated in 5th or 6th grade, and boys in 6th or 7th grade. School screenings are state mandated. Check with your school to see if they offer scoliosis screenings. Several things to look for when screening for scoliosis include 1. Head appears off-centered between the hips. 2. One shoulder appears higher than the other. 3. One shoulder blade is more prominent than the other. 4. Trunk and rib cage appear shifted to one side. 5. Waist appears asymmetrical. 6. One hip appears lower than the other. And 7. Clothing hangs unevenly. One test your care provider may perform is called the Adams Forward Bend Test. As your spinal curve develops and the spine twists, asymmetry of the rib cage or waist is created. A scoliometer is used to measure the amount of rotation. Trunk rotation is determined with a forward bend at the waist and is a reflection of the severity of scoliosis. A rotation of greater than 5 to 7 degrees suggests scoliosis may be present. Okay, so after your care provider or school nurse identifies signs of scoliosis, what is the next step? At the time, you will most likely be referred to a scoliosis specialist to confirm you have scoliosis and analyze the severity of your spine's curve. A few things that may happen during your visit with a scoliosis specialist. 1. Review of the patient's health history and the family history are gathered. 2. The Adams Forward Bend Test. 3. X-rays of the spine are obtained confirming the sections of spine with abnormal curves. 4. In some cases, your specialist may order an MRI to examine your spinal cord. Finally, your specialist will begin discussing a recommended treatment plan with you. Scoliosis can be treated non-operatively or operatively, depending on how large the curve is. Non-operative treatments include 1. Observation 2. Bracing and 3. Scoliosis-specific physical therapy. Operative treatment is surgical intervention and considered when the curve is significant or likely to progress after the patient has stopped growing. Learning you have scoliosis can be scary, but your trusted care provider and organizations like Setting Scoliosis Straight are here to prepare and support you throughout this process. Coming up, Chapter 3 will go over non-operative treatment options, particularly bracing. Chapter 4 will address operative treatment and additional information about surgical intervention.
For mastery of the lesson, I want you to remember these clue words. Health appraisal means screening test. BSE is breast self-examination. And scoliosis is the curvature of the spine. That ends our discussion for today. I hope you have learned a lot. If you have questions and concerns, just message your subject teacher. This has been Teacher Norbert, your School on Air in Health 7. Keep safe.